Very good afternoon, one and all gather here. I, Shiny Christie, and nursing tutor, Sri G.H. Patel College of Nursing, Karamsad, extend our warmest welcome to each and everyone gathered over here on behalf of Medical Surgical Nursing Department, Sri G.H. Patel College of Nursing, a constitute of Baikaki University and Department of Medicine, Sri Krishna Hospital, Karamsad. The moment is very special for us, and we all are gathered here for the celebration of World Diabetes Day 2020.
Your active participation is important throughout the session. Right now, I request everyone to put your audio on a mute to avoid a background noise that may you distract you from the listening the webinar. Throughout the presentation, you can ask your question in the chat box as well as throughout the presentation. We take a great pride in welcoming all the attendees of the World Diabetes Day 2020. We welcome you all together here present now.
World Diabetes Day is organized and hosted every year on November 14 by World Health Organization. The World Diabetes Day is meant for spreading awareness and among general people about diabetes. In 2020, the World Diabetes Day campaign focuses on the promoting the role of nurse in the prevention and management of diabetes.
Now, I request Ms. Neela Darji, she is Assistant Professor in Sri G.H. Patel College of Nursing, to unfold the theme of the World Diabetes Day. She is working in this institute since 1994. Her specialty is a medical surgical nursing and a subspecialty is nephrurology nursing. She has passed NLEX RN examination in the year of 2008. So I request Mrs. Neela ma'am to take over this session. Please, madam, hand over this session.
Thank you, Ms. Disha. And good afternoon, everyone. This year's theme is nurses' role in support.
So before we go to the nurse's role, we'll see some key fact regarding the diabetes. The number of the people with diabetes rose from the 108 million in 1980 to 422 million in 2014. So we can see that how many times it increases within the few years of the number of the diabetes. So it is a quite serious thing. The global prevalence of the diabetes among adults over 18 years of the age rises from 4.7% to the 8.5 in 2014, means the number doubles in the young age. Between 2000 and 2016, there was a 5% increase in premature mortality from the diabetes. It's again the quite serious matters regarding the diabetes. Diabetes prevalence has been rising more rapid in low and middle income countries than the high income countries. Previously, we were telling that it is the Raj Rog. Now it is not like that. We see that here the low income people now more affect than the high income people. Diabetes is a major cause of blindness, kidney failure, heart attack, stroke, and lower limb amputations. In 2016, an estimated 1.6 million deaths were directly caused by diabetes. Another 2.2 million deaths were attributed to high glucose in 2012. Almost half of all death attributes to the high blood glucose occurs before the age 70 years. WHO estimates that diabetes was the seventh leading cause of the death in 2016. A healthy diet, regular physical activity, maintaining a normal body weight, and avoiding tobacco use are the way to prevent or delay the onset of type 2 diabetes. Diabetes can be treated and its consequence avoided or delayed with diet, physical activity, medication, and regular screening and treatment for complications. So, how common diabetes? Diabetes is a serious epidemic. Generally, the if we see in the community book, the definition of the epidemic is a different. But here, the diabetes is a serious epidemic and lifestyle disease affecting the millions over the world. And India is the second to the China with a statistic of 7.29 crore people affected by this condition. About 4 to 2 million people worldwide have diabetes, particularly in low and middle income that we already seen. 1 in 10 people living with diabetes means every 10 people, if you see that one people have the diabetes, out of them in 1 in 2 people live with diabetes type 2 undiagnosed, means 1 in 2 people with diabetes don't know they have it. Means if you see the two people, out of them one people don't know they have the diabetes because they won't have any symptoms like that. And over 425 million people are affected by type 2 diabetes. 4 in 5 people with the diabetes are under the age of 65. Over 50% of type 2 diabetes are preventable, so we have to more focus on this. 2 in 3 people with the diabetes live in urban area. Now what health impact occurs? We already seen what occurs, that's the heart failure. So over the time, diabetes can damage the heart, blood vessels, eye, kidney disease, nerve disease, means neuropathy. Adults with the diabetes have two to threefold increased risk of heart attack and stroke. Combined with the reduced blood flow, neuropathy in the feet increase the chance of the foot ulcers, infection, and eventually the need for the limb amputations. Diabetic retinopathy is an important cause of blindness and occurs as a result of the long-term accumulated damage to the small blood vessels in retina. Diabetes is the cause of 2.6% of global blindness. Diabetes is among the leading cause of the kidney failure. So why I told this? Because as a nurse, we have to focus on this so that we can able to prevent the burden on the government as well as on the family. The family expends the money to treat the diseases. So if we play our role importantly, or that way we can reduce the risk, death rate, all the things we can reduce. Now our role, spread awareness regarding the diabetes, how people can control the diabetes, talk about how to lead a healthier lifestyle, prevent diabetes. Prevent diabetes means we already seen that type 2 diabetes 50% can be preventable. Lower one's risk. Cover lifestyle changes which inhibit the development of the diabetes like yoga, physiotherapy, meditation, and nutrition. We'll focus on these criteria one by one in the role of the nurses. Now we'll see one by one. So screening, prevention and early detection of the type 2 diabetes. Because we see that 50% of type 2 diabetes can be preventable. Decrease the risk factors of the type 2 diabetes. Explain the importance of the prevention of delayed onset of type 2 diabetes in individual at risk. We have to find out the risk factors of the type 2 diabetes and we have to screen those people, those who have the risk factors. And that way we can give the education how they can change their lifestyle, they can modify their diet so that it can be prevent. And if the person will able to prevent, then the complication automatically we can able to prevent due to the uncontrolled diabetes. Explain the role that exercise play in the prevention. Sometimes we think that okay, what happens if we'll do the exercise, nothing will happen, the people won't do that. Or delayed in progression of type 2 diabetes. So what are the roles in delaying or progression of the type 2 diabetes? That also we have to explain to the general people. Explain the importance of the weight control and the role that diet plays in prevention of or delaying in progression of type 2 diabetes. So as per American Diabetic Association, we see in that screening. So to whom we have to screen, that we'll see in this. So type 2 diabetes testing should be done in all asymptomatic adults who are overweight or obese. We already know the definition of the overweight and obese. So all the adults, those who are asymptomatic, so then also we have to screen them. First degree relative with the diabetes, if the mother having diabetes, father, so they all adults again we have to screen in that. We'll see in next slide what screening test we have to go for. High risk race ethnic groups, women who deliver baby more than 9 pound in India, if we say okay, more than 3.5 kg or 4 kg weight, that all women has again to screen for the diabetes, and their baby also have to screen for the gestational diabetes. High density lipoprotein cholesterol, woman or person also screen for the diabetes. Hypertensive patient, then impaired glucose tolerance or glyco-HB is 5.7%, or impaired fasting blood sugars on the previous testing. Then again routine they have to screen for their diabetes, or regular they have to go to their physician to screen for the diabetes. Conditions associated with the insulin resistance, example severe obesity, Niagara polycystin ovarian syndrome, all those person has to go for that screening. Cardiovascular disease, for all other patient testing should be being at age 45 years. If the person won't have these above one, then also person above 45 year has to every year they have to check their diabetes. If the result are normal, testing should be repeated at minimum 3 years interval with more frequent testing depending on the initial result and the risk status. Asymptomatic individual may be screening if they fulfill the following criteria. આપણે આગલી સ્લાઇડમાં જોયું કે એસિમ્પ્ટોમેટિક જે હોય એને 45 યર્સથી અબો હોય એને પણ કરાવવાનું છે. હવે આગલું જે ક્રાઇટેરિયા હતું એ આપણે અમેરિકન ડાયાબિટીક એસોસિએશનનું જે છે આ જે છે આપણા ઇન્ડિયન્સ એમાંથી મેં લીધેલું છે. તો એજ મોર દેન ઓર 30 years, BMI more or 25 kg per m square, with hip ratio man more than 0.90 and women have 0.85, family history of diabetes, sedentary lifestyle, previous impaired glucose tolerance or fasting glucose, and gestational diabetes, recurrent fetal loss or the delivery of the large babies, and hypertension. In screening, not only the blood glucose level should be checked, but if the patient having diabetes, for them also we have to screen. So if the patient, we have to screen for high risk group also, and diabetic patient also we have to screen. So in diabetic patient, is screening is for the psychological and social situation, both we have to see that. For the psychological problems such as the depression, eating disorder, and cognitive impairment, when adherence to the medical regimen is poor. We already know that the chronic illnesses make the psychological problem. You might have seen the patient with the diabetes and with the hypertension. So if you have seen that diabetes patient have the more psychological problem than the hypertensive patients, right? Because once they diagnose, they think that કે હવે તો કશું ખાવાનું રહેશે નહીં, જીવનમાં કશી મજા રહેશે નહીં, I have to take a insulin. That way they will think, and due to that long term treatment they become a depressed. For that also we have to screen for the patients. Then promoting self care. In order to support the patient to self care their diabetes, the patient should be, because every time a patient can't come to the hospital or can't go to the physician, so they have to take their care themselves. So we have to promote, we have to motivate them so that they can do their self care. Supporting the people and help them develop their own self care with the guidance from the registered nurse. Since this is a nurse's role, they have to support, observe, and report any concern that you may have about the patient. They would affect their ability to self care. Encourage the patient to use their personalized care plan. Now, what self care they have to take? So these are the 6 points they have to take care. Healthy eating, being a physical active, monitoring their blood glucose level, complaining with medications, using problem solving skill, developing healthy coping skill, and practicing risk reduction behavior. These all now we'll see one by one. Healthy diet. So here there is a picture for the diabetes patient, right? So skip the rice, but not totally skip, but we have to take a less rice than the chapati, and extra chapati also we have to skip. Then patient should not take the sweet things, and not only the sweet things, they should not take the more fat also, because anyway we are giving the low calorie diet to the patient, that we have to explain. So patient with type 2 generally are put on 1500 to 1800 calorie diet per day to promote weight loss and then maintenance of the ideal body weight. However, this may vary depending on the person's age, sex, activity level, and current weight and body style. Low calorie diet should be given. Then being a physically active. We already know that sedentary lifestyle increase the risk of the diabetes. Simultaneously, if the patient having diabetes and they are not physically active, it is uh, their blood sugar level may not able to control also. And what other physically active helps in raising the heart rate. So whether by the walking, jogging, cycling, swimming, whatever the person will like, they can do some exercise, and so that what happens, how the diabetes can control. So body use insulin more effectively, that way the person can able to maintain their blood glucose level, improve the blood circulation. So exercise also get the blood to all organ, especially the kidney, brain, heart, eyes, which can be injured by the poor diabetic management. Decrease the risk for the heart disease. Reducing LDL, cholesterol, and blood pressure through regular activity can reduce the risk for the heart diseases. Reduce the stress. Stress can increase the risk for developing diabetes. And for the people with the diabetes, stress makes it harder to manage the condition. lower blood sugar and glycoalb. Exercise when uh, uh, diabetes can lower the blood sugar and reduce the glycoalb. It also can improve the protein and fat metabolism and slowing the organ damage. So we have to explain the purposes of the exercise or why the person has to remain physically active, and how they can help in controlling the diabetes and how they can help in uh, prevent the complication occur due to the uncontrolled diabetes. That both we have to explain to the patient. Monitoring the blood glucose level. Patients themselves should keep a chart for their blood sugar level. So when they go to the doctor, they can show their chart so that is there any change in medication or any diet plan changes, so easily it can be done. Complying with the medications. So methods of assessing whether patients are adherent properly on the medication or not. નહીં તો પેશન્ટ તો કે ના બેન હું તો રેગ્યુલર લવ જ છું, કોક જ વાર મેડિસિન નથી લેતો. So how we come to know that patient is taking medicine properly or not? So direct observation method and indirect directly we observe that patient is taking the medication or will tell the relatives, okay, you keep watch on that medication time whether they are taking or not that medication. And if the insulin is there, we'll see that bottle or needle and syringe used. So by that way also we come to know. And indirect method, patient diaries કે patient ને આપણે લખવાનું કહેવાનું કે તમે મેડિસિન લીધી કે ના લીધી અને એનું સુગર માપીશું, તો એના ઉપરથી પણ આપણને ખબર પડી જશે. Indirect method includes the patient questionnaires, patient self-report, pill count. We can count the medicines. So automatically we come to know that patient has taken or not. Rate of the prescription refill. આપણને ખબર પડશે કે એક ઇન્સ્યુલિનની બોટલ છે અને એમાં આટલા ml ઇન્સ્યુલિન છે, પેશન્ટને તો આટલા યુનિટ ચાલે છે, તો એપ્રોક્સિમેટલી 15 days પછી એનું ઇન્સ્યુલિન પતી જવું પડે, બટ પેશન્ટ સ્ટીલ હેવ ધેટ it is a 1 month over. So patient still have, that means patient is not taking appropriately. That way also we can check the patient whether they are taking or with patient's adherence of the medications. Using problem solving, how the patient can solve their problem themselves. Okay, so first identify the problem, find the solution and take a action. Identifying the problems, we know the diabetic patient have numbers of the problems. uh, Glucose levels, patient won't able to maintain their glucose level properly, hyperglycemia may occur, hypoglycemia may occur, other organ related problems may occur. So identifying the problem, so what has changed or going to change, patient will notice themselves, okay, is there, I found any changes in my body. Some common scenario where you need the problem solve around your food, activity, monitoring, medication are going right. So all the things we have to tell them to find out their problems themselves, find the solution. They feel, supposing problem ke, early in the morning patient feel giddy or patient may found perspire, that is the problem. So once the problem will identify its occur in the morning, so we have to tell them solution. So there are, it is the symptoms of the hypoglycemia. So how the patient can manage the hypoglycemia themselves. That way we have to uh, train the patient there to find out their problem and solve problem themselves only. So what kind of the problems may occur? So unstable blood sugar, hyperglycemia or the hypoglycemia, risk for the injury, imbalanced nutrition, risk for the infection and fatigue. Developing healthy coping skill, 2 to 4 doctor visit each year. Once medicine will, patient start to take the medicine, and patient feel good, they won't go to the doctor. શું કરશે? Prescription સાચવી રાખશે. Again with that same prescription they will go to that pharmacy store and purchase that same medication, and unless and until they found any difficulty, they won't go to the doctor. But we have to tell them at least 2 to 4 doctors visit each year. Balanced diet, we already seen that low calorie diet, at least 30 minutes of the exercise most day, step to reach and keep a healthy weight as per their age and their height, at least 2 dentist visit a year, no smoking, eye and foot exam every year, and yearly vaccination. Vaccination why? Because the diabetic patient may have the poor immune system, so vaccination they have to take. Practice in risk reduction behavior. There are some tips we'll see here. To manage the body weight, right? So body weight, we especially we have to explain the diet. No fast food. Right now, major problem is the food. The patient is fond of taking the fast food, the burger and pizza, and though they eat the home food, but we have to tell them okay, what they have to cut from their diet, that we have to explain more. Exercise regularly, eat a balanced and healthy diet, limit takeaway and the processed foods, limit your alcohol, quit smoking, and control the blood pressure. Now we see regarding their mental health. We see then diabetics patient may have depression or eating disorder, they won't adherence on their medication. So it is again not only we have to screen their glucose level, again we have to see their mental health also. To care for someone with the diabetes and mental illness, we should able to have an understanding and awareness of how the mental health issues such as depression and anxiety can affect the people's diabetes. Report any changes that you notice in the patient's normal mental health to a registered nurse or a doctor. If we see that mental patient is in depression or not taking medication properly in frequent way, immediately we have to report the doctor. This could be include the change in medication adherence, mood and appearance, and also the anxiety. Nutrition. Identify the food and drinks with the high sugar content. Patient has to avoid those food which is high in sugar content. Follow the nutrition plan and report any related problems. Measure and record the waist circumference, height and weight of the patient. Why? Because this if diabetes patient need to reduce their weight, but if the patient's waist circumference will increase, weight will be increased. These are the signs of potentially it lead to uncontrolled diabetes. So it is also the important. Report if meals are not eaten. Again, diabetes patient has to take 2 meals breakfast. They should not skip any meal. A proper diabetic menu goes a long way in helping the control high blood sugar level. We have to put together 1200 calorie Indian diabetic diet plan. So to maintain this calorie, we have to give the low calorie diet, but how they can cut the calorie? So they have to reduce the carbohydrate 26 to 45% from their total calorie, 10% from fat, and 20% from their daily protein they have to cut. Urine monitoring, urine sugar and urine ketones that we know, or urine sugars can be done with that strip method or can be with that Benedict solution. But nowadays the Benedict solution method is out of date. We have to tell the patient how they have to match with that strip. Blood glucose monitoring, we know The blood sugar test is procedure that measure amount of the sugar or glucose in our blood. Blood sugar test provide instant result and let you know the following. What we come to know with that blood sugar level, your diet or exercise routine needs to change. If blood sugar is high, so the diet or exercise routine should need to change. How your diabetic medication and treatment is working, whether it is working properly or not. If your blood sugar level is are high or low, your overall treatment goals for the diabetes are manageable. Types of the blood sugar, we know: random blood sugar fasting, PP2BS, GTT, and glycoted HB. Oral therapies, these are the drugs. In the oral therapy, we have to explain the patient by what time they have to take that medicines. After taking the medicine, they have to take the food. After what time they have to take the food, and again we have to teach them to what the symptoms for the hypoglycemia after taking the medicines. Injectable therapy, explain the patient regarding dose, site of the insulin, instruct regarding the care of insulin. Identify and treating the hypoglycemia. So we have to tell the patient or if the patient is on medication and patient won't take food properly, there is a chance to happen of the hypoglycemia. So what is the hypoglycemia? Hypoglycemia is a condition in which your blood sugar level is lower than the normal. These are the signs that we all know. And irregular or fast heartbeat, fatigue, pale skin, shakiness, or weak finger will tremor in the finger, anxiety, sweating, feeling of the hungerness, irritability, tingling, numbness, or are the symptoms of the hypoglycemia. It is very much important to explain the symptoms of the hypoglycemia, because if the patient occurs goes into the hypoglycemia, it is very much important to treat immediately. Otherwise, it can cause the life-threatening situations. So immediate treatment: eat or drink 50 to 20 grams of fast acting carbohydrate. So in that we can tell the patient to eat candy or any cold drinks. Recheck the blood glucose level every 15 minutes after taking that or eating some drinks or chocolates. Have a snack or meal. Identify and treat the hyperglycemia. We know what is the hyperglycemia. Blood sugar level is more than normal. So symptoms of the hyperglycemia, in that early symptoms and later symptoms. So in that recognizing the early signs and symptoms of the hyperglycemia can help to treat this condition promptly. Frequent urination, increased thirst, blood vision, fatigue, headache are the early sign of the hyperglycemia. And in the later sign of the hyperglycemia, so what happens? So ketoacidosis may occur due to the untreated hyperglycemia, fruity smell in the breath, nausea, vomiting, shortness of the breath, dry mouth, weakness, confusion, coma, and abdominal pain. So what are the treatments? So get physical. Regular exercise is often an effective way to control the blood sugar. Take the medicine as direction. So it is very much important. We have to explain the patient how to take the medicine. Otherwise, patient will modify the dose, modify the time. Sometimes what the patient will નહીં આજે તો મારે fast છે એટલે I will skip the medicine. અથવા તો ક્યાંક જશે અને sweet ખાઈ લેશે તો they will automatically increase their dose. So take the medicine as directed. Patient should not be change any dose or anything. Follow the diabetic diet plan. Regular check the blood sugar level and adjust the insulin dose to control the hyperglycemia, but not themselves. They will go to the physician, and as per the order with the physician, they should control their dose. So thank you very much for the listening. If you have any question, you can write in the chat box. Thank you very much.
Thank you, Neela ma'am, for your kind words and enlighten us for your knowledge.
Now we have Dr. Jyoti Manari and Dr. Poonam Binde from Pramukhswamy Medical College Department. We welcome you both, madam.
Thank you, Raksha Madam and team, for inviting us for this webinar. Uh, I'm happy to announce that the IDF has chosen the right theme for this year. Nurses make a difference in diabetes management. We all know how actively the nurses have played their role in the COVID management, and it goes without saying that there is nothing short of making themselves fully available as COVID warriors. What Florence Nightingale did for the Crimean War as a warrior, all of y'all as nurses have made their role much more than a warrior can do in the COVID times. Looking at this role that has been played by all of you, it is very apt that IDF has chosen as uh, nurses as practitioners or diabetes educators. In our country, as against the Wests have diabetes educators as playing a major role. These diabetes educators can be physiotherapists, can be dietitians and nurses in the West. But in our country, diabetes educators become nurses only because such roles are not given to the other professionals. So, as we all know, the healthcare workers, nurses form about 50% of the global healthcare workers. And your role becomes important because diabetes is increasing in leaps and bounds. If you see the population, which Neelaben has already described the burden of diabetes at length, in our country, we have about 10 lakh allopathic doctors as against 72 lakh diabetics as of now. So if we want to give a good support to the diabetics, nurses have to pitch in because doctors cannot be doing all the part of education as well as treatment because we are handling so many patients. Therefore, if nurses are adequately trained to take the role of educators, then our role becomes easier as doctors. And that is what the aim of IDF is. When Raksha Madam told us to take over the portion of diabetes for y'all, we thought this will not be enough. Even 2 sessions would not be enough to take care of it. But this portion has been, almost half of it has been taken over by Neelaben. So our role becomes lesser or becomes simplified. I invite Dr. Poonam also. She is here with me to share my portion of diabetes management. We have divided it into 2 parts. One is an overview of diabetes today, and tomorrow we'll be taking care of insulin therapy as well as diabetic foot care, which becomes a major chunk of management of diabetic patients. So now I hand over to Poonam Madam to talk about.
Sorry, ma'am, for interruption.
Yes.
I would like to welcome Dr. Jyoti Mandari ma'am and Dr. Poonam Bhinde ma'am for accepting our invitation for this webinar and for your presence, ma'am.
Thank you.
It's my pleasure to extend a cheerful welcome to our eminent speakers, Dr. Jyoti Mandari ma'am, Associate Dean Medicine Education, Professor, Medicine Department, PSMC. She has 33 years of experience in diabetic clinic. She had also conducted many research projects related to diabetes, especially in peripheral vascular disease. She has also conducted clinical trials. She is also a member of National Registry of Young Onset of Diabetes. We welcome you, madam. We also have Dr. Poonam Bhinde ma'am with us. She is Assistant Professor, Department of Medicine, PSMC Karamsad. Ma'am has completed her MBBS and MD from Goa Medical College. Ma'am has also achieved double gold medalist. Ma'am had worked consultant at Karnataka Institute of Diabetology, Bangalore from 2009 to 2014. Also worked as consultant physician and diabetologist at Narayana Health, Bangalore from 2014 to 2018. We welcome you both, ma'am.
Thank you. I now
I
hand
hand
it
over,
over.
ma'am. I hand over this session to you both, ma'am.
Okay. Thank you very much. I echo ma'am's thoughts about the role of nurses and what role they play in diabetes management is worth appreciating. Without taking much time, let us move straight to reinforce the burden of diabetes. Like it was already mentioned in the previous talk that we have 7.8 billion people in the world, and 1.38 billion is the contribution that our country gives to this. And unfortunately, 463 million people are living with diabetes and 77 million people are living with diabetes in our country. So the burden is really a huge burden that we have to manage. In 2030, we can only expect the number to rise to more than 100 million. Now, we all know about the types of diabetes. We are very familiar with type 1 and type 2. We also know that type 1 means there is no insulin in the body. The beta cells of the pancreas are damaged either because of autoimmunity or for reasons unknown to us. So these people need insulin for survival. They cannot survive without insulin. And type 2 that we commonly see, 90 to 95% of the patients have type 2 diabetes, wherein insulin is being produced in the body, but it is not working. They have something called insulin resistant. Now we need to know a third type, also called type 1.5 or latent autoimmune diabetes of adult. Why do we need to know about this? Because out of the 90 to 95% type 2 diabetics, 5 to 10% may actually be having LADA. As a doctor or as a nurse, we should be aware of this, because if you encounter any patient who was initially responding well to oral medications and you find that later on they are not doing well, their sugars are not being controlled on tablets, always consider or always think that that person may be having LADA. And what should we do in them? We should tell them to do something called C-peptide test, which will tell us how much insulin they are producing. So type 1, type 2 and LADA is what we should remember. There are of course other rare types of diabetes. We don't need to remember them because they are very rare. But always remember that there is something called gestational diabetes, which is diabetes which gets unmasked during pregnancy. Now we also know how a type 1 patient would present and type 2 person would present. Most of the people with type 2 diabetes do not even know that they have diabetes, because the sugar increases very gradually and progressively. So they do not present with very overt symptoms. Whereas type 1 announces its arrival. Patients usually present with ketoacidosis, needing admission, and it's a life-threatening condition. C-peptide levels will be low or absent in type 1 and they'll be normal in type 2. Now we know a little bit of physiology where insulin is being produced in our body. It's produced by the pancreas, which is a coma-shaped organ located behind the stomach. And insulin plays a very important role of storing. It is a hormone which helps the blood glucose level is to be stored in different tissues. What are they? Muscles, liver and fat. Now imagine if there is no insulin in the body, what will happen? Who will do this business of storing the glucose in these tissues? No one. So what will happen if the glucose is not stored in the tissues? It will continue to hang around in the blood. And that is what we call hyperglycemia. That is presence of blood glucose in increased amount than what is normal in the blood. So insulin or absence of insulin or lack of its action will make the glucose in the blood to remain at a higher level, and this hyperglycemia is the culprit which will damage all the organs and cause complications. Now, like it was mentioned in the previous talk, we are now familiar with the symptoms. But unfortunately, what we need to know is these symptoms may not be present in all the patients. In fact, in our day-to-day practice, we see patients who do not have symptoms. They may be coming for other conditions. Routinely, we do their sugars and we find them to be diabetic. And sometimes many come with complications of diabetes without even knowing that they are diabetic. Now, one would ask how to diagnose diabetes. Remember these numbers. Anybody with HbA1c of more than or equal to 6.5 can be labeled as diabetic. The normal fasting plasma glucose should be less than 100. More than or equal to 126 is labeled as diabetes. Normal blood glucose level after a meal or a 75 grams glucose load should be less than 140. And if it's more than or equal to 200, it is labeled as diabetes. Now, what about those who are in between? Means, suppose somebody comes with a fasting blood glucose level of 110, that is 110, or somebody comes in with a postprandial glucose of 160. They are neither falling in the normal category nor in the diabetic category. Those are called to be having pre-diabetes. Okay, and these are at increased risk of developing diabetes. So that is what we should know. Remember that there is a term called pre-diabetes that we use, and remember that these patients are at equal risk of developing macrovascular complications just the way a diabetic patient is. That is why equal attention, education should be given to this category. Whom should we test? This is already covered. I'll go through the slides quickly. There is something called at-risk group that we have to identify. We can't screen everybody for diabetes. Anybody with family history, either parent or brother or sister, anybody who is obese, anybody who has a habitual physical inactivity, previously identified pre-diabetes, a lady delivering a baby who is more than 4 kgs, people with hypertension, dyslipidemia, ladies with PCOD, or signs of insulin resistance, history of vascular disease, always remember to screen these patients. As far as the management is concerned, there are 4 pillars, that is medications, diet, exercise and education. We will be highlighting on these. Remember that controlling blood sugar is one of the important aspects, and to control the blood sugar, all these pillars are important. You have to tell about diet, exercise, medications and education. Why? Because it is proven beyond doubt that when we have a tight glycemic control, it is going to help us prevent or delay, that is postpone the complications. How tight should be the control? What should you tell your patients? How tight should be the control? Remember the magic number 7? They should aim at keeping their HbA1c levels within 7%. Of course, extremes of age, very young children or very elderly people, very old people, people with advanced complications, people with other comorbidities, people with a short lifespan or shorter life expectancy, people with hypoglycemic unawareness. Do not recommend tight control in them. We can relax it to 7.5 or 8%. Other than these, the magic number is 7%. What happens if the glycemic goals are not met? Jyoti madam will be taking us through the complications of diabetes in the next few slides. Over to you, ma'am.
Okay, now that we've learned the diagnosis, the symptomatology, the way to diagnose, we now go on to the complications of diabetes. We all know that diabetes is a disease which affects almost all the organs of the body. This goes without saying that the nerves, kidneys, heart, eyes, and the feet, all of them are affected to a smaller or larger extent. After, if the diabetes is uncontrolled, you have all the problems setting in. Therefore, it is important and proven beyond doubt by various trials like UKPDS and DCCT, which have proven that if you have a tight control, then your delay of complications is what we are trying to help, which can be achieved if your control is good. So let us have a quick look at the target organs which are attacked by diabetes. This is your normal retina. In the retina, if when retinopathy happens, that is 5 years after type 2 diabetes sets in, that is 5 years after type 1 diabetes, and on diagnosis of diabetes, you have to check for retinal examination, which will tell you whether there is moderate to severe or a severe retinal hemorrhage. These are the fundus photographs which show you that the retina is affected. Why should the patient not be aware of this? Why the patient does not look for retinopathy? Why is the patient unaware that some complications are going on in the body? The reason being, there is lack of awareness that retina can be affected in diabetes, lack of symptoms like visual disturbances. Patients may mistake refraction test as retinal examination. They come and tell you that I had been to an ophthalmologist, and the ophthalmologist has seen the eye, but they don't understand that it is refraction that they have been looked for, not the retinal examination. So what you need to ask them to know whether retina was examined is whether drops were put in the eyes and you were made to sit for half an hour, 40 minutes. Then and then you know that the fundus was examined. So what is your role as nurses? Please remember, you have to educate them regarding all the complications possible so that they go in for the routine tests, because we have already seen when you looked at the burden that retinopathy or giving rise to blindness is one of the common causes with diabetic retinopathy. And therefore, you have to see that every year, once a year, what I usually tell the patient is on the day of your birthday, which you will definitely remember, on your birthday, get all the tests done as a part of your routine once a year. So retinal examination to be done in diabetics every year. Coming to the kidneys, this is one organ, again, if not picked up on time, can result in end-stage renal disease, dialysis and renal transplantation, which is a morbid condition. It creates lots of problems for the patient's family, etc. And therefore, you ask the patient to check for microalbumin, which is excretion of micro quantities of albumin in the urine, which is picked up on the test with urine examination. And once you pick up microalbumin, we have treatment options in the form of ACE inhibitors and ARBs. If given on time, they regress, they alter, or they delay the advancement of diabetic kidney disease. Therefore, control of sugars, along with that control of blood pressure and microalbuminuria regression is what you are going to aim at. So, therefore, diabetic nephropathy, usually patients are asymptomatic. You have to check for the urea creatinine, albumin creatinine ratio or microalbuminuria. Nephropathy is 100% reversible in the early stages if uncontrolled leads to kidney failure requiring dialysis or renal transplantation. Coming to the heart, we have already talked about it. Diabetic individuals are 2 to 4 times at risk of heart disease. Now the problem here is again silent MI, silent ischemia is what is commonly seen in diabetics. They tend not to know that they have any problems with the heart. Patients usually say that I do not have any problems, I don't have any chest pain, and this is known in diabetics. And problem is that these patients, when diagnosed, they already have a triple vessel disease. They have to go in for a bypass or an angioplasty at various levels. Therefore, you have to see to it that you pick them up on time. Risk factors are high cholesterol, blood pressure, smoking, excess alcohol intake, all of these plus sedentary lifestyle. These are all responsible for development of heart disease. Diabetes and the feet, we'll talk about this at length tomorrow, but grossly speaking, diabetes involves the feet in the form of neuropathy as well as vasculopathy. Neuropathy giving rise to loss of sensations then give rise to injury to the foot in some form or the other, leading to infection, diabetic foot ulcer and gangrene. If there is a vascular element also involved, then smoking enhances this element. Therefore you must repeatedly be telling the patients not to smoke. Coming to the treatment, as Poonam already mentioned, there are 4 pillars in the treatment of diabetes. Diet and exercise is one, then comes oral medications, then comes insulin, and therefore, if you do not address all the 4 pillars, diabetes management is hampered. So, coming back to diet and weight reduction, diet is a topic in itself. It takes almost 2 hours to talk about diet at length, but it is going to be difficult. Therefore, I am going to highlight few things, detailing of which will not be possible today. So we know that the various therapies, diet and exercise reduces A1C by 0.5 to 2%, sulfonylureas and metformin 1 to 2%, alpha glucosidase inhibitors 0.5 to 1%, insulin is the champion in this, more than 5% A1C reduction with insulin. So coming to diet and weight reduction, is there anything called a diabetic diet? Clearly, no. It is a normal balanced diet with understanding of portions. That is what, if you understand, then you are very good at managing the diabetic diet. So you know the group of nutrients, carbohydrates, proteins, fats, vitamins, minerals and water, of which carbohydrate accounts for 60 to 65% of our total energy intake. It raises the blood sugar, broken down to simple sugars. 1 gram of carbohydrate gives 4 kilocalories of energy. Out of the total consumed in a day, 80% must be from complex carbohydrates and 20% from simple carbohydrates. What exactly do you mean by complex carbohydrates and simple carbohydrates? Complex are starches made up of more than 2 sugars, have a higher nutritional value. Sources are whole grains, pulses, legumes. Simple carbohydrates are simple sugars made up of 1 or 2 sugars, refined sugars like syrups, sugary juices, fruit juices with sugar, honey, jam, jaggery. These are all simple carbohydrates. Simple carbohydrates have very less calorie value. They'll be immediately increasing the sugar, and therefore simple carbohydrates are to be used in patients who develop hypoglycemia. So you have a sudden rise in sugar, but complex carbohydrates will delay in rising the sugars. Therefore, in immediate correction of hypoglycemia, use simple carbohydrates. When delayed correction is required or for calorie requirement, you give complex carbohydrates. Fiber content in the diet should be increased, which will help in the digestion as well as the consumption should be about 25 grams per 1000 kilocalories. Proteins, components of cells and tissues, provide material for growth building blocks. 1 gram gives 4 kilocalories of energy. Should take 15 to 25% of the calories should be available from proteins. Plants, beans, nuts, oil seeds, legumes, pulses, tofu, cereals. These are all high in protein content, of which tofu is from soya. So tofu or paneer are good sources of protein as far as vegetarian diets are concerned. Milk and milk products, of course. Fats, 1 gram gives 9 kilocalories of energy, imparts palatability to the diet. Important to limit the use of saturated fat and trans fat. Trans fat is the in thing. Many people are aware of this term called trans fats, repeatedly frying in the same oil means giving rise to trans fats, and trans fats are bad for the health. Therefore, you must tell the patient very clearly that repeatedly when you take food from samosas or things from outside, they are fried in the same oil and therefore they are harmful to our body. Unsaturated healthy fat, omega 3, 6, MUFA and PUFA. Saturated are butter, ghee, cheese, cream, palm oil. Now, one question which is repeatedly asked by the patients, or even you all ask many a times, that is it important to change the oils or is one oil better than the other? So the answer to this is you must keep changing the oils. No one oil is good because some oils have more of saturated fat, some oils have a better unsaturated fat component. Therefore, if you keep changing the oils, it is balanced finally. Salt consumption should be, upper limit should be 5 to 6 grams or 1 teaspoonful per day for a person. Coming to this word called glycemic index, which every one of you must know, different carbohydrates increase the blood glucose to a variable extent. So glycemic index is how much extent of rise in blood glucose in response to a food in comparison to an equivalent amount of glucose. That means if 100 grams of glucose is taken, the rise in blood sugar, and compared to that, if the same amount of some other substance is taken, some other food material is taken, how fast is rise in blood sugar is what we understand by glycemic index. So if you give certain foods which have a higher glycemic index, then they will rise the sugar faster. Blood sugar will rise faster, whereas those with a low GI will give a delayed rise in sugars. So these are few values which you can go through. So this, you can see here, barley, it gives a least glycemic index as against ragi, which gives a very high glycemic index. So these are few things which you must know. After knowing what is the various components of your meal, next you must know the activity of the patient so that you customize the diet for a particular individual. So when you talk about activity, you must know whether the patient is a sedentary person, moderately active, or a heavily active person, versus whether he is obese, normal weight, or underweight. Accordingly, you calculate if he is a 70 kg individual and he is sedentary of normal body weight, then you give him, this is the way it is, right? 30 kilocalories into 70, so 2100 kilocalories per day, and that you distribute over a period of the 3 meals that the patient has. Right? So you have something called a food pyramid. This is very well known to everyone at present. You must remember that fats, oils and sweets are the least that you must consume. And this is breads and cereals are the ones which you consume in plenty. Recommended intake of food groups, what we nowadays there is a very clear theory of servings. How many servings per a particular meal should you take? Carbohydrate, how much servings, how much serving of proteins, etc. So servings are measured either in the form of fistful, handful, palmful, thumbful, etc. Or there is a traffic signal method, like red light means avoid these foods, green light means to be taken in plenty, etc. This is one chart which can show you. This is 2 hands full. This is 1 fistful. This is starch. Meat or pulses, 1 handful, 1 fistful, and 1 thumbful. 1 thumbful for oils. So accordingly, you distribute your food intake. So you have, for example, this is the recommended intake: cereals 6 servings per day, fruits 2 servings per day, fats and oils less than 2 teaspoonfuls per day. So you distribute your food intake accordingly and things can be worked out. This is your traffic light system: green zone, yellow zone and red zone. These are the foods which you take as a limited amount or very less amount, and these in the green zone to be taken in plenty. So servings accordingly are shown like this. 2 slices of bread. One serving means 2 slices of bread. 1 6-inch chapati or roti. Half cup cooked rice. Right? Similarly, one serving of vegetable is 1 cup raw leafy vegetables, 3/4 cup of vegetable juice or half cup of cooked vegetables. These are few things which if you understand, then you can make the diet plan for the patient accordingly. Dairy products are also according. So milk and milk products, one serving is 1 cup skimmed milk, 1 cup buttermilk or 1 cup of yogurt, right? And fruits accordingly. Fats are, you can see 2 tablespoons of salad dressing, 1 tablespoon of salad dressing, 2 teaspoons of oil. So these are few things if you understand, then you can plan your diet for the patient. No fasting, no feasting, both are harmful to the patient. If the patient fasts, then the next day he will eat heavily. So that will fluctuate the sugar very tremendously. Therefore, that is not advisable. Right? Weight reduction, 80 to 90% of people with type 2 diabetes are overweight. Therefore, energy restriction to achieve weight loss is a primary consideration. Modest weight loss of 5 to 10% of initial body weight can substantially improve insulin sensitivity, glycemic control, hypertension, and dyslipidemia. To achieve modest weight loss, intensive lifestyle interventions are required to be done. So options available for weight loss are drugs like SGLT2 inhibitors, GLP-1 analogs, and bariatric surgery. Coming to exercise, I will hand over to Poonam.
Thank you, ma'am. So now we have already highlighted the importance of exercise, not only in today's previous talk that we had, but generally we all know that diabetics need to exercise. And even if you're not diabetic, you need to exercise. So we will see that what we don't know. Now there is something called exercise prescription. That means when you tell somebody to start exercise, never tell them to just go and start walking or jogging. Tell them that they have to start.
Is the PPT not visible?
Yes, ma'am, it is not visible.
Okay, just a minute. Please hold on.
Ma'am, below side share screen option is there.
Just a minute.
Can you see now?
Is
Yes,
it
ma'am,
visible?
it is visible.
Okay.
So as I said, never ever tell a person to just go and start jogging from the very moment you tell them to. You have to inform them that there is something called exercise prescription and they should follow that. What is that? When somebody starts exercising, first 5 to 10 minutes should be spent in doing some light activity. Then after 5 to 10 minutes, they do intense exercise. And again after 20 minutes, they cool down period, which is of the same light exercises that they started with. And gradually, day by day, you should increase 5 minutes of duration. So it looks something like this. Look at week 1. Week 1, the patient starts walking normally for 5 minutes, then walks briskly for 5 minutes, and then cools down by walking again normally for 5 minutes. That is, total will be only 15 minutes. So they start exercising week 1 only 15 minutes. Week 2, they'll increase the duration of brisk walking by 2 minutes. That means week 2, they'll be exercising only for 17 minutes. Week 3, they'll increase by 2 more minutes. So if you notice, To reach from 15 minutes of duration to 40 minutes of duration, they will take about 12 weeks. This is important because we do see that when the moment we tell patient to exercise, they either hit the gym or they start jogging and they come to the clinic with injuries, fractures sometimes, or developing ulcers because they will not take care of the footwear as well. So remember, exercise prescription next time you tell a patient to start exercising. So start low and go slow is the mantra. Now, just how ma'am told us about the food pyramid, we should also know about the physical activity pyramid. Everybody cannot go to the park. Everybody cannot go to the gym. So, for such patients, you can tell that the routine activities that we do in our house, if done properly and for enough time, can also help us burn calories. If you see playing outside with a child, taking the stairs instead of the lift, just helping around with the gardening or giving a bath to your pet or pick up some toys or things thrown around the house, walking to the store, these can also help us burn calories. Dancing, which doubles up as a hobby, this also will help us burn some calories. So people who cannot go to the park or gym, please tell them to do these activities. This chart shows how much calories we can burn by doing simple activities. I would like to take your attention to gardening, that is on the top list, and cleaning and mopping. These are things we can do every day sitting at home. So remember this. People always ask, what is this intense exercise? What do you mean by light exercise? So remember that any activity and which you're doing, if you can sing while doing that activity, it is called light intensity. Any activity, if you are able to carry a conversation, is it seen? Is the screen seen? Can you see the
Yes, ma'am.
PPT?
Yes, ma'am, it is visible.
Okay. So as I said, light, moderate and vigorous intensity means if you can sing while doing activity, you can call it light activity. If you can have a normal conversation when doing something, that is moderate intensity. And if you're too winded or too out of breath to even talk, then it is called vigorous intensity. Now, many times questions are asked about whether the same exercise prescription should be told to all diabetic patients or should we consider whether they have complications or not. And the answer is yes. If a diabetic patient has complications of diabetes, keep some things in mind. And what are those things? Coming to complications of eye, if somebody has non-proliferative diabetic retinopathy. Now we know that it can be mild, moderate or severe non-proliferative diabetic retinopathy. If it is mild, do not worry. They can do any type of activity. If it's moderate or severe non-proliferative diabetic retinopathy, tell these people to avoid exercises of higher intensity, very intense level, because they may increase their blood pressure levels. So they should avoid lifting heavy weights, or activities which need them to bear down. Now, what is bear down? Imagine if somebody is constipated, they have to really strain at stool. That is the way of bearing down. So, any activity which needs the person to bear down or lift heavy weights, which can increase their BP, should be avoided in these people. There will be patients who have undergone laser therapy for retinopathy, for proliferative diabetic retinopathy. Learn in detail tomorrow. They have an insensate foot, means they do not feel the pain or temperature changes and they can hurt their feet. That is why they should avoid repetitive weight bearing exercises such as jogging or prolonged walking and step aerobics. So, what can you advise them? You can advise them swimming, cycling, or seated exercises, which can be done sitting in a chair. There are a lot of videos on YouTube wherein people can learn exercises which can be done in seated position. So remember, neuropathy, they should not do exercises which require them to put more pressure on their feet. People sometimes have autonomic neuropathy. Their blood pressure and heart rate varies. And they should avoid exercising in extremes of temperatures. They should make sure that they are hydrating themselves well. And they should wear light cotton attire. What about people with kidney disease? Unfortunately, these people have a very they are very they have very limited capacity to exercise. So we don't expect them to brisk walking or jogging. So whatever activity they can manage with that level is allowed. However, they should not do and ask them if they have any of the complications. And remember the points we discussed. Coming to medications, we know that you have oral medications and you have injectable medications. There are a lot of oral medications which are available. Let us familiarize ourselves with them. So we all are familiar with that. The pancreas is not working well, the beta cells are not doing their job, then these medicines do not work. And because of this action that they make your pancreas produce more insulin, the side effects are hypoglycemia, which can be prolonged because they have a long half-life. So hypoglycemia and weight gain. These are the side effects of sulfonylureas. You have meglitinides which also do the same thing. They act on the pancreas, makes it produce more insulin, and the side effects are hypoglycemia again. Luckily, these have a very short half-life. So the hypoglycemia also will be for shorter duration. Then you have the metformin, which is the age-old drug around for so many years. What is the side effect? Some people may not tolerate it. They may have loose motions, vomiting, gastritis. Some people may have very, very significant weight loss. People with renal diseases always remember to calculate their creatinine clearance. And if it is less than 30, you do not give metformin. Metformin is an insulin sensitizer which makes your body use the insulin which is available. The fourth group is alpha glucosidase inhibitor, which acts only in your intestine. It will prevent the carbohydrate from breaking down into smaller, simple carbs which can be absorbed easily. That is why all these carbohydrates which are not broken down are passed or excreted in the stool. That is why, since it doesn't get absorbed in your blood, it does not have any systemic side effects. However, because it works only in the intestine, many people may get gas, flatulence, bloating, and even loose motions. The fifth group is the TZDs or thiazolidinediones, which again is an insulin sensitizer, and only one drug is available now. The other two were banned long back. Pioglitazone is available still. Side effects are weight gain, fluid retention, anemia because of bone marrow suppression, and some studies have shown that higher dose given a long period of time may give rise to osteoporosis and bladder cancers. SGLT2 inhibitors, they act on your kidney. They are weight neutral. They are the newest kids on the block. Very expensive but very effective. They are now recommended for people with heart failure because they cause diuresis as well. Side effects can be included Am I audible and is the PPT visible?
Yes, ma'am.
Okay. So these are all the oral medications which are available. I was on gliptins. Side effects are, they are weight neutral, so they are good in prescribing to patients who are already obese. But recurrent UTI, pharyngitis and pancreatitis are known with this group. So having learned about the OADs, we move to the next slide. Insulins. Now we will be talking in detail about insulin tomorrow. They are the most physiological therapy available, and like ma'am mentioned, they are champions because they cause so much of a HbA1c reduction. They are safe and can be prescribed at any stage of diabetes. Earlier, it was believed that many years of diabetes, at the end of the day, at the end of long duration, you prescribe insulin, but that is not true. You can prescribe insulin even on the first day of being diagnosed as diabetic. We'll talk about them in detail tomorrow. Now, next few sections are important. Our patients will commonly ask us these questions. So we have compiled the commonly asked question in the next section, and ma'am will take over from now on.
Okay, I think we are tired of listening to everyone. So I'll go through fast with these few questions that the patients ask. One is about artificial sweeteners. You all know, and we have been using in plenty. We have been seeing patients use them in plenty. Artificial sweeteners are saccharin, aspartame, okay, Now, sugar-free is the one which is commonly used by most of the patients. You have come across sugar-free being used. The other is stevia and the other is Splenda. These are few ones which are commonly used. And the problem with this is that the taste is not very palatable to everyone. So that is the only hitch. Those who can tolerate the taste, they are good. They can be used. There is a limit to using them. We'll talk about it. Uh, the problem again you have to remember is that you don't, it doesn't withstand high temperature. Retain sweetness, certain of them retain sweetness at high temperatures, can be used in baking and cooking. Sucralose. Stevia is derived from herb, therefore less harmful. It is sweetest of all. So saccharin you can give 5 milligram per kg, aspartame 50 milligram per kg. It is 200 times as sweet as sugar. Sucralose is 600 times as sweet as sugar, and stevia is around 1000 times as sweet as sugar. Hypoglycemia is one which you must know thoroughly, because these are common symptoms which patients develop when excessive dose of the drug is given, oral hypoglycemic agents or insulin, or the patient skips the meal. This can result in hypoglycemia. Sugar less than 70 with symptoms which are relieved promptly after giving glucose is called as hypoglycemia. If not treated on time, it can be fatal because brain uses sugar for activity. So if the hypoglycemia persists, the patient can develop hypoxic brain damage, and that can result in a vegetative state. Therefore, we have to be very careful when we are treating patients of hypoglycemia. So, should be considered in patients presenting with confusion, seizures, altered sensorium. And these patients, if treated on time, we have already, Neelaben has talked about symptoms of hypoglycemia. So these are the various symptoms: shakiness, sweating, anxiety, dizziness, difficulty in concentrating, hunger, fast heartbeat, blurred vision, tiredness, headache, irritability. All these are symptoms of hypoglycemia. Remember, you can be of real help to the patient. It may be your closest of relative, or it may be a person on the road who tumbles down with a hypoglycemic attack. If you know the history that patient is diabetic and you treat on time, you will be a savior for that patient, and that is, they will bless you like anything. So hypoglycemia should be known to each and every individual. Rule of 15 for hypoglycemia, meaning immediately consume 15 grams of quickly absorbed carbohydrate. Again, as I mentioned earlier, you have to give short acting or simple sugars for the action to immediately be corrected. Blood sugar to be corrected immediately with 15 grams of quickly absorbed carbohydrate. Document the blood glucose with glucometer. Wait for 15 minutes, recheck the blood sugar. If not better, give another 15 grams, as this quickly absorbed carbohydrate will not last long. It is important that the person is given something else to eat, which may be a complex carbohydrate. Recheck the blood sugar after another 15 minutes. If 3 consecutive blood glucose readings are low, then you should immediately consult your doctor or go to the emergency room. When any diabetic person who is at risk of hypoglycemia is traveling, they should be advised to carry sugar cubes. They are available as hypotabs in the market. So they should carry an ID card, they should carry these hypotabs, they should carry some, or and wear a strap indicating that they are diabetic. These are all very important, especially in type 1 diabetics who do not know how much to exercise, when to eat, when not to eat, and therefore end up with hypoglycemia or diabetic ketoacidosis. Both ends are true with type 1s more commonly. So hypoglycemia unawareness, this is another thing. As the name goes, patients do not develop symptoms. They are unaware that they are hypoglycemic. So that is becoming a very big problem. So if you can detect and see the patient and detect it on time, then you may be able to save the patient's life. It is true with brittle diabetes and it is true with long-standing diabetes. Another is the sick day rule, meaning thereby, in a patient who is sick, the sickness itself is a stress to the body and that gives rise to hyperglycemia. So when the patient is sick, instead of omitting all the diabetic drugs and not taking food also, patients should be advised to take small quantities of liquids as much as is possible and go on taking liquids till the patient is able to tolerate. If there is a lot of vomiting, then he should be taking some juices which he can tolerate and sugar-free fluids if your blood glucose is more than 240. Examples, clear soups, vegetable broth, diet, soft drinks. These, if the patient has vomiting, stop taking fluids for 1 hour. After 1 hour, try small sips of regular soft drinks. If vomiting persists, then call your doctor and act as much as early as possible. Right? These are some replacements for the carbohydrates. If the patient has persistent fever for a couple of days, persistent vomiting or diarrhea, presence of ketones, blood glucose are high, these are all features of diabetic ketoacidosis. They should not wait and they should consult the doctor as early as possible. Coming to the last few slides, which tell you which investigations to be done and when. These are for any diabetic. So, as you all know, all diabetics should have an HbA1c every 3 months or maximum 6 months. HbA1c is a slightly more expensive test, so patients are not very frequently ready to get it done. So, you may say once in 6 months at least, if not once in 2-3 months. Annual evaluation for fasting lipid profile, liver function test, microalbumin, thyroid profile, dilated fundus examination, dental examination, foot examination and cardiac evaluation. All of these once a year. Okay, what is required is that they know that certain complications are possible and they are unaware of these complications, therefore they should be looking for these. Okay, A1C if results not available, these are few. TSH in type 1 diabetics. These are few of the tests that should be routinely done. Okay, one good news for you all. IDF has come up with free short course for nurses as diabetes educator for 3 months. You can visit this site called IDF School of Diabetes and free short courses is mentioned on that. You click on that and you will get the free short courses. It is very much advisable that you do it. It is very less time consuming. It is about how many hours? 14 days. It is for 60 minutes. 60 minutes in. They have to complete it over a period of 1 or 2 months. You can just go and visit this site and you will know the details. It is a very good course and I think if it is taken up by all of you, it is free at present up to December or January I think. For the next 3 months it is free. So there are many other courses, role of diabetes educator, etc. So you should try and visit this site and try to take it up. Okay, thank you so much. Any questions? Yeah, we screen sharing nikal do. Any chats are saying any questions? Any questions, Anna?
Now I request to participants for ask questions. Also, you can post your question in the chat box. Now I request to participants for ask the question. Also, you can post your question in the chat box.
People are tired, I think.
Ma'am, every time you accept our invitation, you never say no. We are truly delighted to have you here today. Thank you very much, madam, for sharing your excellent talk on diabetes mellitus.
Thank you.
Thank you.
Thank you very much, madam.
Now, I would like to thank Dr. Jyoti Manari ma'am and Dr. Poonam Binde ma'am for enlightening us and sharing your knowledge. So, we are at the end of this today's session and we will meet tomorrow again for further celebration of World Diabetes Day 2020. So, thank you all the participants and thank you both ma'am, and also I would like to thank Miss Neela ma'am for unfolding the theme and sharing your knowledge. For tomorrow's session, the timing will be 11 to 1. Thank you, all of you, for your valuable presence. And if any inconvenience is there, so we are sorry for that. But thank you, all of you.
Thank you.